When an older loved one faces a major life change, families may rush to help, sometimes making quick decisions about relocation. But these well-intentioned moves can trigger transfer trauma, which can have a real emotional and psychological toll. Amy, why is timing so critical after a life-changing event?
I think the first thing I'd want to explain is transfer trauma is a real thing, and it's trauma. And that I think of it like a continuum. Like you have a move and then you have anxiety with a move. But if you have transfer trauma, it's physical, lost weight, inflammation, falling, confusion, disorientation. If it's kind of normal move anxiety, it's more on the emotional end. But I think the critical piece of information is kind of expect there to be some reaction. But if it's on the severe end, you need to know exactly what to do. I know you've had a lot of experience with this.
This is actually my specialty, and so what I would say is that anytime your older loved one participates in the decision and in this discussion, and hopefully it's their idea and they've really bought into it, they automatically are going to be a lot happier. When they feel that it's been forced on them, then that's when they may move in with a great deal of sadness. And sometimes they've left people no choice because they did not plan ahead, they did not let wishes be known, they waited too long, and they forced someone's hand to make a medical decision that was probably critical. And so that's, and every situation is different, but what I'll say is that rush decisions risk making mistakes that could cause future moves, and now you're just maybe having a cascade of transfer traumas. And so you want to be very thoughtful in where you move, and I would get professional help on that. And then also manage the chaos and the timeline. Throwing a senior into chaos because of a move is not wise. Best practice is we get moved first where we're going and we get settled. We call it resettle. Get totally resettled. Maybe some things you figure out don't work in the apartment, send them back, you're bringing more stuff, and totally getting it to feel like home. And your loved one does not need to be in the middle of all the sorting and just the chaos of vendors and contractors coming in, or certainly home showings. And so there's definitely a lot of people out there that can help make it smoother and follow that timeline so it's much easier. And they're not seeing their life dismantled right in front of them.
Right. And a quick reminder, moving a person isn't like moving furniture.
Right.
And so familiarity for our aged community is actually medicine. And so it's really important to note that this isn't just about a move. Transfer trauma exists many times for a visit, for a vacation, for a hospitalization, for a rehabilitation. And it can show up in a number of ways. The worst being delirium, which is that hyper state of confusion that can happen. And we see that oftentimes, and it gets discounted and misdiagnosed as, well, it's just an onset of dementia, or it's a worsening of the dementia, when it's really just that hyper state of confusion.
From the medical standpoint, it really is not aware in the hospitals, and the staff does not know. And so I think just education in the hospital staff and all that to recognize this is a real entity.
Yeah, I think recognizing what the symptoms can be and what you can do to help manage them. Like how many, and I don't know, this is TMI, how many have a traveler bowel issue? Lots of people. Bowel movements don't happen when they're not in a familiar place. And so we move our aged community who already have bowel issues because of dehydration and other things. And then we're wondering, why are you agitated? Why are you confused? Why are you frustrated? Why are you in pain? Well, when did you poop?
Yeah.
I mean.
And the other thing I think about, give them as much control as possible when they're in their new environment. As many decisions as you can give them, let them have decision and some power and autonomy in this move.
Yeah, and limit the amount of moves. Don't go from hospital to rehab to home to rehab to hospital. Try to limit the amount of moves. So if you're going to be moving your aged person to a new home, move them once if you can. Don't move them and decide the food's not good 3 weeks later and move them again.
Try the food first.
Try the food
first. Make sure that you've really made a professionally advised move so that you're not moving within 6 months.